With Mexico declaring a medical emergency over COVID-19, one of the country's major concerns is the capacity of its health system. Temporary structures to augment care during the outbreak include this inflatable hospital in the state of Hidalgo. At nearly 2,000 square meters, this pop-up hospital in the state capital aims to treat COVID-19 patients from across the region. Indeed, coronavirus has arrived in Hidalgo state with numerous confirmed cases, including the governor himself, who met with President Andrés Manuel López Obrador in mid-March, possibly exposing Mexico's 66-year-old leader to the virus. With a 50-patient capacity, including 10 intensive care unit beds, the hospital serves as an example of how to prepare for the pandemic. José Luis Imbert is a molecular biologist based in Pachuca and says such installations will be key to tackling the virus.
It's important to have these type of mobile and transitory hospitals. Indeed, the authorities should also be thinking about installing the type of field hospitals used during military campaigns.
That's happening in Mexico City, where some 200 temporary clinical tents are being installed as the virus spreads. Yet just as important is public conscience, which can be difficult in a country with significant levels of poverty.
While the people are well informed, there are many who can't afford to stop working. That's unavoidable. Those who live day to day and have to leave the house to satisfy their most basic needs.
That's happening too. The Hidalgo government banned public events, sparking protest from informal workers like these, who are losing income from the cancellation of local events.
It was a good decision to cancel the fair because there are concerns about the disease, but the government has to think about the situation we'll be placed in while unable to work. We've been offered no help. We don't want to make trouble or take greater action, but if they don't listen to us today, later on, we will.
As Mexico takes action to control COVID-19, popular moves such as Hidalgo's inflatable hospital will likely be counterbalanced by the tough decisions its leaders will be forced to make. Alistair Baverstock, CGTN, Pachuca, Mexico.